Mind is a movie based on the real-life story of the famed mathematician named John Nash and his lifelong struggles with his mental illness. Nash enrolled as a graduate student at Princeton University in 1948. He was a recipient of the prestigious Carnegie Prize for Mathematics. He became obsessed to find his own unique and original mathematical theory. In the meantime, his roommate Charles became his best friend. After successfully developing his own theory, known as the game theory, he became a professor at the Massachusetts Institution of Technology. Here, he met his wife, Allison, in his class, and they got married shortly thereafter. One day, he runs into his former roommate, named Charles, and his young niece, named Marcy. While he was working for the Pentagon deciphering complex encryption, he encounters a mysterious secret agent by the name of William Parcher. Parcher gives him a new assignment to look for patterns in magazines and newspapers, possibly from the Soviets. He was ordered to write a report of his findings and place them in a specified mailbox. And this secret assignment is going on, and then he became increasingly paranoid and begins to behave erratically. However, the side effect of the antipsychotic medication affects his sexual relationship with his wife and his intellectual capacity. This leads him to stop taking his medication, causing a relapse of his psychosis, which almost cost the life of his infant son. He withdraws from society until 1970s. Subsequently, he tries to return to reality by going back to teaching in Princeton. He eventually earns the privilege of teaching again with the help of his former colleagues. Over the years, he has learned how to distinguish his hallucination and delusions from reality. He goes on to win the Nobel Memorial Prize in the economics for his revolutionary work on the game theory. So for the objectives, we have general objectives. This case study aims to gain a comprehensive knowledge about paranoid schizophrenia of John Nash in the movie entitled A Beautiful Mind, including the practical exercise about the health problem. We also have specific objectives here, which are to describe paranoid schizophrenia. Next is to determine the causative factor of the disease. Next is to recognize the clinical signs and symptoms of the disease. Next is to know and understand the possible medical and nursing management. Next is to determine the appropriate nursing care for the patient. Next is to identify the patient healthcare status. Next is to gain more understanding about the patient's condition.
I'm going to tackle the patient's profile and the genogram of the movie entitled The Beautiful Mind. John Forbes Nash Jr. was an American mathematician who made a fundamental contribution to game theory, differential geometry, and the study of partial differential equations. Nash's works has provided insight into the factors that govern chance and decision making inside complex systems found in everyday life. So John Forbes Nash Jr. was born on June 13, 1928 at Bluefield, West Virginia in US. He was also died on May 23, 2015 at the age of 86 in Monroe Township, Medicine County, New Jersey, US. In his educational background is at Carnegie Institute of Technology for his BS and MS, and at Princeton University for Gentleman for his doctorate. Nash is also known for his works and accomplishment, like Nash equilibrium, Nash embedding theorem, Nash functions, Nash-Moser theorem, and Hilbert's 19th problem. He has also a lot of awards, like John Ben Newman Theory Prize 1978 and Nobel Memorial Prize in Economic Sciences at 1994 and member of National Academy of Science in 1996, and the last was Abel Prize in 2015. And the last one is genogram, which is John Purves Nash Jr. is the father, and he has two spouses, which are Eleanor Stair, and they had son, John David Stair, and the second spouse is Alicia Lordy Lopez Harrison, and they had also one son, John Charles Martin Nash, who suffered schizophrenia as he inherited to his father, John Purves Nash Jr. And that's all. Thank you.
And I'm going to report the onset of illness. But what is onset of illness? This is the first time that there has been noted to be a change in one's usual health status, with the identified sign and symptoms being able to be directly attributable to a specific disease process. Upon watching the movie A Beautiful Mind, I didn't expect that the symptoms or the sign and symptoms that I was looking for was right from the very beginning. It was during graduate school. John's first major hallucinations was of his roommate Charles. Later, he had a hallucination of Charles' niece. Both remained with him over many years, even after he realized that they are not real. Following graduation, he did some decoding work for a government, followed by his second major long-lasting hallucination, believing that he was a secret agent, and the delusional belief that the government had hired him to find and decode a secret messages in a magazines and newspaper. So that is the onset of illness. Now, let's proceed, and I'm going to tackle about his mental status. Mental status examination is an assessment of current mental capacity through evaluation of general appearance, behavior, any unusual or bizarre beliefs and perceptions, like for example, delusions, hallucinations. So upon observing Mr. John, general observations, his weight is 196 pounds, height of 71 inches, body mass index of 27.4, and for his skin, no rashes, lesions, itchy, and has a mid-dry skin for his whole body. No hair, nails, or skin changes. And for his head, no neurologic illness, headache, and head injury. And for his eyes, reports is 20/20 vision. And for his ears, hearing is good, no tinnitus, vertigo, and infection. And for the nose, no cold or fever. And for the throat or mouth, no bleeding, sore, or hoarseness. Let's proceed for his appearance and behavior. Mr. John Nash dressed appropriately. He appears to be the stated age. He is quiet and focusing on interview. He is cooperative and reasonable. Next is for the mood and affect. Mood appears to be depressed. His affect is constricted. Next is the speech and thought process. His speech is normal with appropriate rate and volume. He had no loose associations, tangential thoughts, thought blocking, or other signs of thought disorder. Next is for the thought content and perception. He is recurrently seeing and hearing three figures, which is Charles, who was thought to be his roommate in college, Charles' young niece, Marcy, and William Parcher, who is a secret government agent. He claims that he has been perceived them as a real people until his first admission last year. He continues to see and hear them even when he is on psychotropic medication, but is able to distinguish it from reality and not to react to it. But since he stopped taking his medication, it became more difficult to distinguish it from reality and greatly interferes with his life. Next one is the cognitive and intellectual functioning. He stopped taking his medication when it interferes with his memory or intellectual capacity. It was unacceptable for him since he intended to go back to his work as a college professor. He reports no cognitive or intellectual problems since he stopped taking psychotropic medication. His memory is intact and he was able to recall dates with regards to his work history. There was no evidence of gross cognitive dysfunction during the interview. He has insight into his problems and is goal directly to manage his mental illness. Next is for his mini mental status exam. He scored a 30, no cognitive impairment. Next is for the Hamilton Depression Scale. He scored 12, which would indicate mild depression. And lastly is for the PANSS, which is for the Positive and Negative Syndrome Scale. He scored 65, both high on positive and negative symptoms. That ends the mental status examination for Mr. John Nash. Thank you.